One of the scariest types of allegations that can be leveled against a nurse is that you are diverting medications. And this comes up actually with alarming frequency, and it's so avoidable. Now, obviously, there are cases where nurses do divert, but usually it's due to an error in judgment or an error in procedure. So, for example, if a nurse doesn't waste medication in front of another nurse, then that means that there's no evidence about what happened to that drug. So you need to follow proper nursing standards and protocols, as well as any standards or protocols in place by your employer, so that you can have evidence that the wasting of medications, things like narcotics, is done appropriately. Now, if you don't do it appropriately and an allegation of diversion arises, what do? Well, first of all, you can demand or ask for a drug test, offer a urine test right on the spot if there was a mistake made, and you want to make sure that they don't think that you are a user. So if they don't follow through with your request, then in my opinion, you should go down and get tested on your own by a lab and have them bring back negative results. So you can close that door and show that you're not a user. So I have had staff members in the past tell me that the initial belief is that a nurse is either a user or a seller or a pusher of the medication, when usually it's just an error or oversight. So another reason for allegations of diversion is because the nurse gives more medication, such as a narcotic, to his or her patients than another nurse or other nurses on the floor. And this is a real problem, because what I see happening, frankly, is when a patient is PRN and they are experiencing pain, there are a group of very caring nurses who will actually administer the medication. And frankly, there are some nurses that don't care as much. And so overall, the numbers of administering narcotic among those would be lower than those who are super hyper diligent about their patients. And that can raise a red flag, believe it or not, if you are outside of the normal, let's say, bell curve of what is normally done on a particular floor or in a particular hospital. And especially today, with the focus on an opioid crisis, they're looking at these statistics very carefully. So documenting what you do and how you do it is extremely important. There are other grounds for diversion of medication, but the main one is when you don't waste properly in front of another nurse. So it's important to know the procedures where you work. As I understand it, and I don't want to speak because I'm as a nurse, because I'm not a nurse, but based on the feedback that I've received over many, many cases, is that you have to waste the drugs in front of another nurse, which means making sure that the nurse is watching when you do it. Don't quote me on where you're supposed to do it, but I know you need another nurse present. So diversion of medications is extremely difficult to overcome if you haven't done those steps. So guess what the board is going to do if they have accused you of diversion? Well, they're going to want to put you on a suspended license so they can put you on a probation agreement. They want to monitor you. They want to see over time if you can continue to test negative for improper drug use. So diversion, something as small as not wasting in front of another nurse, could lead to a multi-year probation agreement where you're being tested 24 times a year for up to 5 years. So you don't want to have that happen. And there may be a concern, if it happens more than once, that you may have a substance use disorder, which we also have to address by having you evaluated by somebody who's an expert in that area. The best thing you need to do is to call me. Let's do that free consultation. Let's discuss the merits of the case against you and any mitigating circumstances, and explain to the satisfaction of the board that you are not a diverter as a user or as a reseller of these medications.